So nivolumab, as you know, is a novel immunotherapy which has been approved in other solid tumors. The question is, does immunotherapy play a role in AML, potentially in the maintenance setting? I think that data is still an open question. Currently, I know there are trials looking at immunotherapeutic drugs like nivolumab in a maintenance setting. This is potentially a very attractive area in which to use that drug. These are patients that have intact immune systems, haven't been previously heavily treated with myelosuppressive drugs, and could benefit from a checkpoint inhibitor. They also are at a clinical stage of their disease where they might have minimal residual disease and not large tumor volumes. And this is a situation where about half of our patients that go into remission from AML standard intensive therapy are expected to relapse within the first year or two. So if we did add an immunotherapeutic and we were able to extend the survival or eradicate the minimal residual disease, we should see a readout on those studies in a very short amount of time. So I think it's a very attractive proposition. The trials are ongoing to address that, and we may need to wait a little bit to see what the outcomes are going to be, because of course this is a maintenance trial, so we have to wait and see whether patients actually recur or not.